This presentation on vulnerable populations was prepared by Justin Turner, Kelly Irwin, and Jeanette Broadbent, specifically covering information on hearing, visual, and mobility impairments. The media plays a huge role in how we view certain populations. When it comes to mobility impaired, visual impaired, or hearing impaired, often they're portrayed by the media as helpless and incapable. An example, in the movie The Miracle Worker, Helen Keller is portrayed as being dumb and unteachable at times until someone actually sits down and takes the time to get her and get how she works. There are many other examples in the media where these individuals are portrayed as helpless and incapable and are often at the center of laughing or comedy segments of certain movies. There are some examples where impaired individuals are seen in a positive light, and one of those is Soul Surfer. It's about a young woman who loses a limb to a shark attack, who comes back and becomes a skilled surfer despite her impairments. The main role that the media plays is contributing to biases and also misunderstanding, or these populations being misunderstood. Family is a crucial part of successful outcomes for impaired individuals. The family is the primary unit for physical, emotional, and social support. The family is also incredibly influential over the outcomes related to rehabilitation and adjusting to life with a new impairment. Research showed that some newly diagnosed with a visual impairment, if they had family support, they showed better adaptation to their new vision loss, as well as greater life satisfaction and less depressive episodes. It is evident that family support is a crucial part of developing coping skills and increased healing. It is also shown in studies that when family members don't know how to help their individual or underestimate their abilities, negative outcomes or health outcomes are seen. Peer support is also an important part of healing and adjusting to life with a disability. Proper emotional support from friends and family decreases stress and decreases negative health outcomes. When peers and family members overcompensate and doubt the abilities of their vulnerable loved ones, more depression is seen. As well, we see that adults with low vision are most often institutionalized because of their lack of social support rather than the decline in health. Genetics play a huge role in the impaired, and we see that more than 60% of blindness in infants is inherited. We also see that 50% to 60% of hearing loss in infants is due to genetic mutations. Mobility impairment also is affected greatly by genetics. We see multiple cases of spina bifida, muscular dystrophy, and other genetic inherited traits that lead to mobility impairments. All of this genetic influence contributes to a cyclical nature or a reoccurring vulnerability to this population. Utah really works to provide resources for these individuals, the visual, hearing, and mobility impaired. We see a lot of free support groups, whether that be online or in person. There's a lot of free resources online that they can access as well. We have a school specifically for the deaf and blind. There's a lot of social support as far as getting jobs and helping these individuals find jobs where they can contribute and be consistent and hold a job. Those suffering with chronic disabilities often, though, don't have the health insurance needed to receive the full treatment to properly manage their disability. It's a costly disability, and a lot of support is needed. We find that the majority of this support comes localized around Salt Lake, kind of the middle of the state, where you get out in the outskirts, and they lack some support in those areas. Research does suggest that people often display a negative attitude toward those with physical disabilities, such as an obvious mobility impairment. With that being said, most men and women, when asked, would state that it's unfair to view a blind or deaf person as in a negative light. They also view it as socially unacceptable, stating that their disabilities are uncontrollable and not by choice. However, this is where implicit biases come into play. Persons with disabilities and their households are more likely to live in poverty. The evidence is based on hunger indicators, traditional poverty indicators, and multidimensional poverty. For high-income countries, too, the evidence is consistent, suggesting that persons with disabilities are more likely to be income poor, with 29% of the disabled men and women living under the national poverty line in the U.S. Healthcare treatment for chronic conditions is expensive. Without the financial ability to treat medical conditions and access to healthcare, outcomes are poor. 90% of people with visual impairments live in low to middle class households. Those with eye conditions, hearing loss, and mobility impairments need treatment to live as healthy lives as possible. They require a lot of support, whether that be eye drops, mobility uh, help like canes, walkers, so forth, hearing aids, physical therapy equipment, support groups, primary care visits, consults, surgical procedures. There's a lot that comes with it. Black and white differences within disability outcomes have also been studied. A study done in 2011 reviewed activities of daily living among vision impaired and hearing impaired. The African American population were found to be at increased risk for disability related to activities of daily living. Socioeconomic disparities seem to lead to some of that. With vision impairments in adults over 85 years old, it was found that African American disability odds were higher compared to Caucasians. With all disability outcomes combined between the ages of 50 and 69, the African American population had a 1.5 to 2 times odds of disability compared to Caucasians. Cultural diversity, language barriers, and religion can affect medical compliance among healthcare consumers. The more patients that perceive their physician as a culturally competent were found to be more compliant with their medical recommendations. With this being said, it is important for the healthcare consumer to feel as though the healthcare provider respects their religious and cultural beliefs and preferences. It is always an important aspect to consider. Research by the University Hospital in Liverpool showed that many practicing Muslims do not use eye drops during Ramadan. Ramadan is a time when members fast and therefore do not consume food or liquids and consider eye drops as a liquid. So it's important to consider the religious practice of those who are being seen. Women are found to have a greater risk for mood manipulation and lack of health information. They were also found to experience higher prevalence of blindness. It's believed to be genetically a factor as well. Women are also found to be less likely to seek healthcare services. It's largely believed because of their role often as mothers, caregivers, they often neglect themselves at times. Access to health services varies greatly across different locations. More than anything, it's related to income. Rural areas and low-income areas in low-income countries are locations where they lack healthcare services and healthcare funds for proper treatment. This is where things like telehealth and telemedicine can provide great aid to these individuals who live in these areas. They can have access to a medical professional when they otherwise wouldn't have been able to go. Implicit and explicit biases are very common among this population. An implicit bias that has been shown in studies is a preference for individuals without disabilities. Without consciously thinking about it, an implicit bias is a preference that's not something that we have on the forefront of our mind, a preference that we have without even thinking about it. And often individuals who are impaired are seen as less capable, like we discussed earlier, less able to complete tasks that a person who otherwise wasn't impaired would complete without a problem. So often, individuals with these impairments are skipped over for jobs because it's felt that they wouldn't be as successful. And this is where explicit biases come in. There are a lot of explicit biases where people will straight up tell these individuals they're less capable or less likely to succeed, they're less educated. All these things contribute to their ability to succeed in the workforce or in life. Many people won't admit to negative attitudes towards those who are not blamed for their disabilities, such as the blind or deaf. Often these biases are implicit and are things they're not aware of. The highest attainable standard of health is one of the fundamental rights of every human being. It's something that we should strive for as a nation and as internationally as a world to provide that for each individual. But health inequality is seen, and it's largely been linked to economic status. Regions of the world with higher economic class have been shown to have better outcomes. Things like as simple as diarrhea in certain areas of the country can be devastating, killing millions